there. Welcome to Chilling with Dr. Chellam. I'm Dr. Chellam, founder of Holistic and Integrative Center of Novi, a functional medical practice here in Michigan. Some of you have been following our YouTube channel, and for others it might be something new. Before I get into the topic that I'm going to discuss in today's video, I want to preface this with a little change that's coming to the channel. Many of you who have followed us know we have podcasts. We try to give you as much information as possible regarding various health issues. What I realized is most people are looking for very concrete solutions to their chronic medical problems. If you don't understand functional medicine, let me just take a moment to explain what that is. As a traditional medical internist, I had practiced medicine, I would say, for about 21 years before I realized what we are taught in medical school is to help patients handle their disease and live with their disease in a very tolerable way. In other words, reduce your pain, reduce your symptoms, so you learn to live with the disease, but you don't necessarily get well. Not only don't you get well, you pile on other conditions. For instance, I think people come to us hoping to feel better with knee pain. If there's swelling, we take out the fluid, we put steroids, we give them anti-inflammatory, the pain gets better, and they continue to do what they've always done, which brought on the knee pain to begin with. We never truly resolve what drove them to have the arthritis. So people tend to say, I'm a diabetic, but my blood sugars are under control. I take my medication so I can eat what I want. It doesn't affect me. Or my blood pressure is under really good control. I just take a medicine or so and, I feel nothing, I feel fine, and I'm good. But are you truly well? And what you will realize is with every decade, your health gets worse. And is that supposed to happen? Here's what I've learned in my journey as a functional medical doctor. Number one, disease is not inevitable. And with age, it's not normal to have disease. Chronic disease is certainly not normal. The body has an innate capacity to heal, and a lot of times the reason it develops disease is because it does not have what it needs to heal from all of the insults, whether it be stress, food, or lack of activity, or there's something in its way that does not allow it to heal. That's the science of functional medicine, is getting to look at the body, look at each of the cells to see what does it need, what is the support it needs to get better. Having said that, what do we do in holistic icon? We try to get to the root cause, simplify that process, because nobody wants to eat healthy. I mean, we all know we got to eat healthy and exercise on a regular basis, but nobody really wants to do that. You're not motivated to do that. How do you really do this in a very simplified manner? How can I make it simple for you? How can I change your way of living? Those are the things that we work with, we learn from our patients, and we're able to support our patients in their journey. I hope you understand, get an overall feel of what we do. Today's video, I really want to talk about one of the conditions that we can help people. I need you to have a good understanding of this particular condition so that you can really get better if you're going to work with a functional medical practice like ours. So I'm going to talk about diabetes, the 3 types of diabetes that everybody needs to know. So let's get started. I always forget this. Before I get started, can you do the thumbs up so that every time I put out a video, you will be notified? And also subscribe to our channel, because the more people who subscribe, apparently the information will get to more people. It's important that we all understand that disease is not inevitable. It is something that you have the power to change. So go ahead, give the thumbs up and subscribe. All right, let's get onto the topic. So there are 3 types of diabetes you need to know. And I think everybody knows type 1 and type 2. And the third one is very special for the ladies. So only you're at risk, and it'll be the last one that I'm going to discuss. So if you hang out with me, and there's going to be a question I'm going to ask, and if you get that answer right, if a lot of people answer that correctly, I'll just do a draw, and one of you will have a free consult with me, and absolutely no strings attached. You can bring your blood work, whatever it is, and I will give you that consultation. So let's go on to the 3 types of diabetes, 1 and 2, and the third one is a surprise. We will talk about it especially if you have no idea about diabetes. I'll get you clued in. So type 1, people understand what type 1 is, but let me really get into the nitty-gritty details of this. Type 1 is only about 10 to 16% of the general diabetic population. Type 1 has been described in ancient times, like 3,500 years ago. It's in the Greek papyrus. It's also in the Indian medical literature, the Arabic, the Japanese medical literature, and they all describe it as this particular individual who is young, very thin, drinks a whole lot of water and pees a whole lot. So it was also called the polyuric wasting syndrome because they just peed a whole lot. At the same time, they lost, it was almost like their muscles and limbs were melting, and then they had sweet urine. So they were able to describe it so accurately, but they didn't know what actually caused it. And that came on later. Now, from the time they realized that there's something in our body that controls our blood sugar, and this something comes from a specific structure in the body, at that time they didn't know there were organs. It took about 300 years to realize that. So to discover insulin, when they started doing investigations and realizing that there are chemical substances that are produced by certain cells that impact our health, that was the birth of endocrine, the endocrine sciences. And then the fact that we can actually check for these, like we can check for blood sugar, we can check for insulin. With that came the birth of blood chemistry. So now that we knew this, between 1600 and 1900, it took them forever to actually extract insulin. So the greatest milestone in the history of medicine is the discovery of the extraction of insulin and injecting it to the first type 1 diabetic, whose lifespan just immediately doubled. So this is important to understand, that giving insulin is probably the most crucial thing for type 1 diabetics, and without that, it's a death sentence. In other words, type 1 diabetics do not produce any insulin. So why is that? Are they born that way? Is there something that we can do to change that? There are two things you need to know about type 1 diabetics. Type 1 diabetics have what is called an genetic trait, or HLA gene. What is an HLA gene? Human leukocyte antigen gene. And it's now called major histocompatibility complex. And why is that important for you to know? Remember, when you get your renewal of your driver's license, if you say you want to be on the donors list, they give you that little red heart that you stick on the corner of your driver's license. You get on the donors list. So what are they actually looking for when you become a very compatible donor to a recipient? The recipient is the person who needs the organ, and the donor is the person who will be giving the organ, like a bone marrow transplant. They look at the fingerprint of the cells, which is the HLA, or major histocompatibility complex. What does this mean? It means every cell has a way it presents to the immune system, saying, hey, I am a part of this body. That means the immune system knows not to attack that cell because it's a part of your body, I should say. And it is only designed to attack a foreign, like a bacteria or virus organism that's in your body. When that immune system fails to differentiate between the two, foreign and self, it creates what is called autoimmunity. That means it attacks its own cells. And one such risk, the HLA for type 1 diabetic, it's called DR, kind of an ironic name for a gene that puts you at risk for destroying yourself. But it is the DR gene puts you at a high risk for autoimmunity, particularly destruction of the cells that produce insulin, which are called islets of Langerhans, or beta cells. Now, why is this very unique? The beta cells are not in isolation, even though islets of Langerhans means island. They're next to other islands of cells. Alpha cells that produce another hormone called glucagon, gamma cells that produce somatostatin, and other cells that produce enzymes for digestion of the protein in the pancreas. But the beta cells get destroyed when you have this HLA trait. So that's number one. But why does the beta cell get destroyed? What really happens? And this is where you need to know about. The second thing is the trigger. Trigger is usually an infection. It could be a toxin, it could be some kind of stressor that triggers off your immune system. And remember, when you have that HLA trait, your immune system gets so triggered off, it goes and kills its own cells. So you need to have the HLA trait and a trigger. And we find that pediatricians are very astute for this, where, a child has an infection, a simple common cold, and after that, this failure to thrive. That means the child doesn't gain weight, drinking a lot of water and still losing weight, eating a whole lot. And so they do check for type 1 diabetes, and usually the treatment is giving them insulin. Why is insulin so important? For a very simple reason. The way we all survive and are alive is because our cells are constantly working to produce energy for us to function. For me to sit here and talk to you, for you to sit and watch this video, for your brain cells to work, everything requires energy. This energy comes from our food. So when we consume food, the smallest molecule of food is glucose. Glucose has to get into the cell. It cannot just get from the blood into the cell. It can jump into the cell. The insulin is the vehicle that gets it into the cell. If there's no insulin, there's no groceries for the cell. And there's no groceries, it cannot make energy. And if it cannot make energy, it starves. Because cells have that innate ability to really survive, what do? They draw energy from storage. And what are the storage forms of energy we have? Fat and protein. And so fat gets broken down, protein from the muscles get broken down. That's why the person loses weight. But when you burn fat and protein without insulin, there's something that happens, because insulin allows the metabolism of all of these products. When there is no insulin, a lot of acid gets produced. So most people with type 1 diabetes, if they don't use their insulin, they're non-compliant, or if they don't know that they are developing type 1 diabetes, or before 1921, when they didn't have a treatment for it, it usually is a death sentence. So remember, type 1 is no insulin. And insulin is absolutely essential for the cells to survive. Then comes type 2. The common grounds for both type 1 and type 2 is both of them have high blood sugars. But that's where the similarities end. Now, type 2, on the other hand, has too much insulin. So what is too much insulin? If insulin is what is needed to get the cells to get their glucose, why would too much insulin be a bad thing? Here's what happens. Remember, insulin carries the groceries into the cells. So say 8 o'clock you had your breakfast. Your insulin got stimulated, took all the oatmeal energy, puts it into the cell. The cell has to process to get its own energy. As it's processing, insulin knocks on the door and says, hey, I have a 10 o'clock snack. And the cell says, 8 o'clock, you just ate oatmeal. I don't need any more glucose. So now it locks the door and will not allow insulin. So insulin has a problem. It has all this glucose. It's got to put it away. And where does it go? It goes to the two major storage sites. One is muscle, number 2 is liver. But you've been sitting in front of the computer for 8 hours. Your muscles haven't moved. So the muscle is also full. It says, hey, I got all the glucose you gave me the last time. I have it still as glycogen and a little fat. So I don't think I need more. So does the liver. The liver also says, I'm full. I have too much fat in me. I'm not taking any more of your glucose. So insulin has to do something, or that glucose in your blood becomes an acid. So what does it do? It takes it and creates a new bucket, a new drum in which it collects it. And that drum is called adipocyte, or fat cell. So you can see how a type 2 diabetic is a little heavier. Unlike the thin type 1 diabetics, they tend to store more fat because they have excess of energy. So look at type 2 diabetes as a disease of abundance. And type 2 diabetes is also described in the historical medical literature as somebody who is very robust, like a little heavier, very affluent, like the royals, the merchants, the businessmen who had access to a very expensive commodity those days, sugar, pure cane sugar, and also refined flour. And they had servants to do their work, so they didn't have too much activity. And they had a lot of things they had to manage, so there was constant stress. So really, it's a disease of abundance, abundance of nutrition, abundance of rest, and abundance of stress. So the treatment of type 2 diabetes should be Really simple. You create a scarcity of nutrition, which is intermittent fasting. You create a scarcity of rest, which would means more activity, getting up and dancing, moving, exercising, and scarcity of stress, which would be meditation, walking in nature, or prayers. So it sounds very simple. However, have you ever seen a skinny fat diabetic? Somebody who says they are diabetic and they look perfectly like a normal body mass index? Well, that's a completely different story, and we'll get to that when I describe type 2 diabetes in depth. So for now, just remember this. It's a disease of abundance, and creating a scarcity might be a quick solution. What do type 2 diabetics need to do? Same thing like type 1 diabetics. They need to eat whole foods rich with fiber and fat rather than eating a high calorie diet. It should be more of, again, both of them I think will benefit from having scheduled times when they would eat. Type 1 absolutely needs insulin. They probably need a better schedule of their meals. Type 2 will need lesser frequency of meals, but when they do eat, it has to be very wholesome, lots of fat and fiber. People tend to do a high protein diet, eliminate carbohydrates, and that's not required at all. In fact, good and bad carbs, we'll do a video on that later, but for now, stick with a lot of fiber and fat. So type 2 diabetes, you get a few takeaways. Increase your activity, reduce the frequency of the meals, and manage your stress. It's simpler said than done. There are tools that we will give you and on how to do it. The third one, this is where it's a lady special, unless you are like Arnold Schwarzenegger in Junior, where men can get pregnant. It's the gestational diabetes. It's a diabetes that comes on only when you're pregnant and goes away soon after you deliver the baby. What puts you at risk? Two things. Number one is the age of the mother. We are now, as a generation, women tend to settle in their career before they start their family, which might be a good thing, but also keep in mind when you're having your babies later, the body tends to have been exposed to a lot more stress a little longer. So the tendency of blood sugars to go up with age and with the physiological stress of pregnancy is a little higher. So gestational diabetes is seen in women who are older age. The second thing that happens with these women is they have the same risk factors as type 2 diabetes. That means they have underlying resistance to insulin because there's an abundance of energy, abundance of stress, and abundance of rest. So what my advice and my recommendation to folks who are planning on pregnancy later on in life is make sure you're exercising regularly, eating very nourishing meals, and really taking care of your body, trying to optimize your health before you get pregnant to reduce that risk. So as you can see, these three types of diabetes, they kind of blend with each other. At the same time, they have different physiological mechanisms and different triggers. And so what I would say is identify where you are. And the best way to identify that is, of course, your history. Remember, type 1 is in younger people, so it's usually called juvenile diabetes or insulin-dependent diabetes. Type 2 is more in the adult, little heavier, so it's more of an overnourishment kind of diabetes, and gestational is only during pregnancy. But here's the biggest takeaway from all of this. Health is very intuitive, and it's your business. You need to know about your health and your body. Disease is what we go to medical school for, and that's the business of medicine. I'm Dr. Chellam, founder of Holistic and Integrative Center of Novi, a functional medical practice here in Michigan. The best place for you to find your best doctor, which is always you. Hey, don't forget to do the thumbs up and subscribe. Take care. So here's my question for you. Gestational diabetes, is it closer to type 1 or type 2 diabetes? The reason I ask these questions is not to check your knowledge, but to make sure that I have been clear in my presentation. So type in the answers, and I will put your name in the draw if you have the right answer, and you will be booked for a consult with me. See you soon.